Hello, thanks for joining me. I'm Dr. Lauken. I'm going to talk about how to make certain choices in relation to radiation treatment. And this is for people who've had what's called choosing wisely surgery. And typically, these are folks over 70 who had small, better breast cancers and who've had no surgical procedure of any kind to the lymph nodes under the arm. And that's because the lymph nodes didn't seem abnormal either on examination or ultrasound. And also, this is for people who have what are positive hormone receptors. And those might be conceived of as little receiving docks on breast cancer cells. And the reason they're important is that one can take pills that either block those receivers or block hormones from being around at all. And those have a beneficial effect in as much as they make it harder for breast cancer to get a new footing. So if a person's had the visible cancer taken out, and if they're taking the pills that are trying to put the brakes on any new cancer cells from getting a footing, what about radiation treatment? What is it going to add? And on the other hand, what are its side effects? And just like when we buy an insurance policy, we ask ourselves, what benefit will it give and how much does it cost? The same question is reasonably put around radiation treatments. So our first choice with radiation is to say, well, let's not give it anywhere. After all, person's taking the pills, the visible cancer is gone. Or you could say, well, we could just treat with radiation the neighborhood of where the cancer was. It's called partial breast radiation, just like it showed in the little circle there around the lumpectomy site. Or we could say, no, let's treat the whole breast, and because there are lymph nodes right nearby the breast under the arm, let's cover those as well. And now let's look at what happens when we follow those possible choices. If we just go with the pills, we know that there would be over about a 10-year period, about a 10% chance of the cancer coming back in that general area, in the breast or the nearby lymph nodes. So if we turn that around, there's about a 90% chance that it won't come back in those areas. Now, what if we add the whole radiation treatment, the breast, and nudging up to the lymph nodes that are closest to the breast under the arm, but not taking in all of the lymph nodes? Well, what we find is that that does lower the chance that the cancer will come back in that area. It's only about 1 or 2% at about 10 years. So if we turn that around, there's a 98 or 99% chance that it won't come back in that area. And what about that middle choice? What if you use radiation just to part of the breast where the cancer was removed, so-called partial breast radiation? And if a breast cancer has certain features, that it's just one focus as opposed to a bunch of breast cancers kind of nearby to one another, and if it's been operated on with a good margin as opposed to being right at the edge, it's a reasonable choice. And in that situation, although there isn't as much data, we can estimate that there'd be about a 3 or 4% chance of it coming back in the general area in about 10 years' time. So let's look at that and to the question of how to make that choice. One of the key things is that whichever choice is made, it's not a matter of absolute life and death out of that choice, because when we measure what's called survival, being alive, and the chance of dying from breast cancer in 10 years, whichever one of those choices was made, that number is the same. So what we're talking about is the chance of the cancer coming back in that area. Because after all, if it does come back, well, you can go after it again and basically catch up. So just to compare those choices, if we do nothing with radiation, the chance is about 10%, as we see on that picture on the left. If we do this partial breast radiation for a suitable person, it's about 3 to 4%. And if we do this whole radiation, the breast and immediately next door, it's about 1 or 2%. But if we look at it from how much does it cost in terms of radiation side effects, obviously on the left, if we don't give any treatment, there's no side effects. If we treat the partial breast, say to an area that's the size of a smallish to medium orange, depending on the size of the breast, there'll be a few side effects, but most people find that fairly easygoing. And then if we treat the whole breast, well, there's a few more side effects. And most people find it not too bad at all, but there is a small chance of having some more bothersome or persistent side effects that could impact quality of life for a small minority of people. So when we look at those choices and those numbers, it really is a matter of looking at things in a balance, and it really is all about you. Your preferences as far as those pills that you're on. Are they bothering you? Do you think you'll be able to stick with them? That's important. Your preferences about radiation. Is it something that you're generally comfortable with or generally uncomfortable with? Likewise, your comfort with any risk of local or regional recurrence in that area. Some people would say, I'd walk over hot coals to prevent it from coming back in that area, even if it can be salvaged. I just don't want to see it. And others would say, oh, 90%, that sounds pretty good. I'm going to be in that group. And then we also have to look at, is your particular cancer a good fit for that partial breast radiation option? And then when we look at whole breast radiation, is this something that you would be most unlikely to get significant side effects from? Or are you in a group for which there would be some risk markers for having that whole breast treatment be more of a problem for you? So when you meet with the oncologist, whether it's me or someone else, those are the kind of things that would be considered. So thanks very much for your time. And just to close, if we look at radiation, adding it to pills after you've had the choosing wisely surgery where the lymph nodes haven't been handled, radiation definitely will lower the chance of the cancer coming back in the breast and nearby nodes, and from about a baseline of 10% to a range of 1 to 4%, depending on how the radiation is done. And there are choices depending on your preferences. The best choice is going to be the one that fits you the best.